So I'm going to talk now about crossed eyes in children. There are two main or two commonly seen patterns of crossed eyes, and these are heat affecting the eyes and overexcitement. There are two other patterns which are seen less commonly, and one is congenital, the person is born with crossed eyes, or paralysis of the eyes, and you should determine whether the person really has paralysis of the eyes. It's fortunate that they're less common because they're that much more difficult to treat. The principles of the treatment are similar, well, they're similar to all conditions, but if you have congenital crossed eyes, you have to start right from the very beginning, and the outcome is somewhat uncertain. And so we won't be talking about that very much. When you're treating paralysis of the eye, you're trying to cure a paralyzed muscle. And just as curing paralyzed muscles in any other part of the body is concerned, it takes a lot of treatments. Treatment is preferably given every day, and the treatment should be given within the first 3 or at any rate 6 months of the onset of the problem. If it's given any later than that, then it's unlikely that you'll have any good results. But the two commonly seen ones, the two which are functional crossed eyes, are, as I say, heat affecting the eyes and overexcitement. So how can you tell the difference between the two? Well, when it's heat affecting the eyes, a lingering heat in the system, then the amount of crossing of the eyes is the same. It doesn't vary from day to day, or only varies slightly from day to day. But if it's due to overexcitement, then you will notice that the eyes become crossed more when the child is overstimulated. One of these patterns can be treated as a medical condition. The other is a lifestyle one. So the pattern of lingering heat affecting the eyes, the treatment is to clear the heat, and it's relatively simple. The point which I particularly like using is pericardium 7, Darling, which has the effect of clearing the heat, causing the squint. I also like to combine this with liver 2, which also will help to clear heat, and I quite like to use large intestine 4 also. So that's 3 points which can be used for clearing the heat. You may use additional points around the eyes, although in children I tend not to use the points around the eyes, simply because of the difficulty of treating children and being sure that they will stay still while you're actually putting the needle in. So these points are very helpful in clearing the heat, and you can think of between 10 and 15 treatments is normally enough to clear the heat. As far as overexcitement is concerned, you can help a little bit there, but really you need to discuss with the parents about the child's life, and you will normally find that the child has a very overstimulated life. Goodness, most children now do have a stimulated life compared to what it was like 20, 30, 50 years ago. 50 years ago, it was few children ever travelled by car. There was much less stimulation, much less television, much less mental activity. So you need to look at the child's life and reduce the stimulation in their life. You can also support the child's energy by treating the kidney, because part of the reason why the children get so overstimulated is that the kidney energy is usually a little weak. The kidney energy doesn't, the kidney is not strong enough to hold the qi down when a strong stimulus comes. So you get this qi rushing up to the head, and you get a false heat going up to the head. So the squint, the cause of the squint is the same as for the heat pattern, only in this case it's like a false heat which is rising up due to overstimulation. And the treatment that you can give is to strengthen the lower part of the body, for example using Moxa on bladder 23 and Moxa on kidney 1 to draw the energy down from the head. But these points will not be successful if the overstimulation continues. So that gives a pointer, a guide towards what treatment you can do for crossed eyes.